Happy Wellness Wednesday, everybody. It's Dr. Leslie from WellCare. One of the questions I get quite often from patients is, will self-manipulating or cracking my joints cause arthritis? Now, while it might seem to chiropractors like fingernails going down a chalkboard, the answer to that question is no, it does not cause arthritis. In fact, there's plenty of research that disproves there's any link between manipulating and arthritis. And in fact, when done professionally in a position where it actually needs to be moved, moving joints can be helpful to decreasing the progress or the onset of arthritis in the first place when done professionally. Now, the problem that can happen most often is usually in the ligaments or the joint capsule itself for one of two reasons, okay? A lot of times people don't feel, if you don't hear that noise, and we'll talk about why that happens another time, but if you don't hear that noise, people will overdo the movement and they can actually irritate it, even dislocate it. But more often than not, the typical problem is in the ligaments, because over time, when people do this consistently, whether in the neck, most often it's in the neck and the knuckles that we see it, but what can happen is the ligaments get stretched and stretched and stretched. I have patients do it 50 times a day, and that will become too loose. And then because it becomes too loose and stretched, it'll start almost talking to you and saying, why are you not stretching me? And so it leads to like a vicious cycle of continuing to do it, and it'll cause some pain and inflammation. That is what happens. It's not arthritis, it's the pain and inflammation caused by you overdoing it, essentially. So the answer to that question is no, it does not cause arthritis. Hopefully that was a nice tidbit of information for you. I hope everybody has a great day. Please follow us on Facebook, Instagram, and now TikTok, yay, on WellCare Chiro or Leslie Quick DC. Thanks, guys. Have an awesome day.